Stages of Alzheimer's disease. It's important to note that whatever staging system is used, the disease affects each person differently. 90% of the time, what I just said to you about Alzheimer's disease is true. 10% of the time, it doesn't fit. All right? Order in which symptoms appear varies. The length of each stage varies. Stages may overlap, no clear line where one begins and one ends. Not everyone will experience all symptoms, different stages for different types of dementia. Okay? So what we've got is a progressive decline in cognitive function that's affecting your function in society. The first functional impairments are the independent activities that keep you outside the house. Once those independent activities get restricted and you advance further, it affects your personal care items, your ADLs. So in fact, you can stage dementia by finding if the person has any ADL, activities of daily living, or independent activities of daily living impairment. Because if they have independent activities of daily living impairment, by definition, they're mild to moderate. If they have activities of daily living, personal care involvement, they have advanced dementia. Okay? So that's a functional staging. Right? There's a guy, Dr. Risberg, I think he's out of New York City. And I've spoken to this guy. He's a really nice guy. And he has spent his life observing people with dementia. And he made a very, very simple observation. And one of my colleagues made the same observation, but he never became famous for it. But Dr. Risberg became famous. And the observation that he made was, hey, this disease of dementia is the reverse of pediatric childhood development. In other words, the baby is born, the baby lifts its head up off the sheet. The baby starts to track vision, hearing. The baby sits up. The baby walks. The baby gains continence of feces. The baby gains continence of urine. The baby starts small words, syllables. Syllables become sentences. Sentences become thoughts. Develop social skills. Social skills become developed to a higher level of discussions. They start to be able to go to university. In university, they start to be able to look at opposite sides of a discussion. The brain is fully developed. With dementia, executive function goes, higher planning. As the executive function goes, the speech compresses. As the speech compresses, you start getting effects on your IADLs, independent activities of daily living. You start getting lost. You start getting problems mixing up your clothing. You start putting on the colors wrong. You start dressing inappropriately. You can no longer dress without assistance. You start getting into problems with bowel function. It's getting worse. It's falling off and is reversing from what the child was to the adult. So Dr. Rosberg made this observation. So he said, well, if we got childhood pediatric development, and we can stage the growth of an individual from childhood to adulthood, maybe we can now stage the deterioration process in dementia. And that's exactly what he did. And he found, in general, 90% of the time, you can go from one stage to the next. So if you've got a person who's in the early stages of dementia, in dementia, we're just starting to recognize, we can say, you know, with a fair degree of sensitivity and certainty, that you've got 2.5 years before we get into the next stage. Now, if we give you these disease-modifying drugs, we might be able to stretch that out longer, depending on how this disease is affecting you. And if you happen to be one of the ones that is a responder. Does that make sense so far? Mm-hmm. Follow. Good. Stages of Alzheimer's disease, early, middle, and late. We talked about that. The global deterioration scale, which is what I just went through, actually, is what Dr. Risberg describes. And we can get you more stuff on that if you want to talk about it. And in that staging system, he breaks down the whole course of the disease in stages between 4, 6, 12-month stages. And you will see as things go through, he actually describes what the person is like. And that's really important to know as a caregiver. And I'll tell you why. Because there's one thing really interesting about dementia. Dementia has its inexorable decline in a set pattern for each individual. But if you don't go from symptoms of mild dementia to symptoms of severe dementia without going through moderate. You follow?
Mm-hmm.
What if a person is mild demented and then they get sick? Guess what happens? If they got a comorbidity, remember, say they had a pneumonia and they got early dementia, they could really go down and become urinary incontinent. You don't see urinary incontinence until late stage dementia. How can that be? Well, what happens is when you get an infection or a severe comorbidity, severe illness like a cancer or something, that puts an additional strain on the body's immune system. And when that happens, guess what happens? The old simple computer starts to fail. And they drop down 3 or 4 stages. So when you've got a really good team of people and good caregivers, they can tell you. I'll go on my ward over on the Veterans Division, and the nurse will say, Dr. Butler, you need to see this patient today. And I said, well, what do you mean? He's not right. I said, well, what do you mean? Well, last week he could do this, this, and this, and now he's over here. So why? How did he get there? Like to be bedridden today, and like he was up walking last week. There's got to be something going on. He's sick. This is not dementia doing this. There's something else here. You follow? So for a caregiver, that's important to recognize. Because if you know the stage, and you can tell them if your loved one is in trouble on another level. And you can say, no, doctor, I think you need to see him. I think there's something else going on. Okay, so that's why this staging is so important. And it also gives us a handle on what the type of dementia is. Because we can be wrong as diagnosticians, right? I could have the wrong picture on the puzzle. Right? So if I get the wrong picture on the puzzle, I better make sure that I know how the puzzle unravels. A diagnosis, Alzheimer's is a diagnosis. A diagnosis is like a picture. Now if I get the wrong puzzle pieces in there and I get the wrong picture, I could probably give the wrong treatment. So it's important that we follow the patterns and we know the patterns. And this is why we're having this little discussion today about the different types. Because everybody's not Alzheimer's disease. Socially we say, oh, you got Alzheimer's disease. Well, no, not necessarily so. Okay? Now, in the early stages of Alzheimer's disease, your mental abilities, you get mild forgetfulness, difficulty processing new information, difficulty concentrations, problems with orientation, communication difficulties. So you could say that person is depressed, couldn't you?
Mm-hmm.
And depressed people with early dementia look like they're depressed. And sometimes, in fact, we treat them with antidepressants and they don't get better. And one of the syndromes that early dementias present at is a recalcitrant depression. It doesn't respond to treatment. And downstream, the light goes on. Oh, they were demented all along. And you can have dementia and have a coexisting depression. So these things can go together, right? Behaviors, passiveness, withdrawn from useful activity, restlessness, anxiety. It's an interesting restlessness, this pacing, you know? And they can't get comfortable. There's something wrong. I don't know what it is. I got one patient that comes in to see me. I'm in a fog. This week I'm in a fog. Doctor, I'm in a fog. Next week he comes in. I'm fine. I'm in a fog. I'm fine. A beautiful description of a brain that's muddled. He's in a fog. He knows it. He feels it. People in dementia are often in a fog. And when they're in those fog days, we got to be very receptive as caregivers. You know, it's easy to be a caregiver when the person is bright and they're active and they're communicating with you. But when they're in the fog and they're uneasy and they're restless, that's where it's challenging. Because they're going to read you, and you can make that fog bad or you can make that fog better. They need your support and their reassurance at that point. Right? There are 2 signs you're going to see in Alzheimer's, which are classic. The brain in Alzheimer's is still capable of new learning. And when a person has Alzheimer's and they realize they're forgetting things and their language is not quite good, they will turn to their spouse for the answer. That's called the head turning sign. That's learned. That's learned behavior. They've learned that the default program when I got a memory problem is the spouse. Mm-hmm. Now, the spouse will do this when they come in to see the doctor. I usually sit down. I got 2 people in the chairs next to me, and the person with dementia is sitting next right on, and then the spouse is in the next chair. And I'll say, how are you today? And he'll look at me, fine, because social skills are engrammed into your brain like the Trans-Canada Highway. But if I say, how old are you? Ask a specific question. You'll get a vague answer back. Well, you know, I'm about 80, I suppose. And then he'll look over to the wife. And the wife or the spouse will say, you're 85, darling. Right? So he's learned that behavior. Now, I'm asking another question. I say, and I understand you're from Old Perlican. And he says, yes, yes, doctor. And then the wife goes like this. That's the negative nod. He's already confabulated in the answer. The neural plaque has knocked out the connection. He's recircuited to another connection, and he believes it. Right? But she is there. So when you see, as a clinician like me, a head-turning sign and a negative nod, that's dementia. 10-second diagnosis. Finding out the type is where it gets harder. Right? Okay. Early stages of Alzheimer's is physical abilities, mild coordination problems, mood shifts, and depression. Okay. So, the mood shifts you had to be aware of. The days when you're in the fog, you need to be aware of. And depression is there too. So you'll often see them being treated with antidepressants in that part of things. But in coordination, mild coordination problems, visuospatial. They tend to trip up easily, they tend to fall. And that's where we get into the coordination problems. Depth perception gets altered in this disease. So if you ask them to draw clocks, most people are familiar with the doctor's asking you to draw the clock. The hands go funny and the circle is not right. Or if you ask them to draw boxes, they can't draw the box. It'll be thrown off. There's a famous painting of a piazza in Italy, a bridge that crosses the in Vienna. Not Vienna, is it? It's in yeah. How's it? Italy, yeah. Pisa, yeah. Right? So this bridge, and I forget the name of it. It's a marble bridge, and there's this famous painter who got dementia, and they show his sketching. The doctor would have him sketch the bridge, and when he sketched the bridge in early dementia, it was beautiful. But the river, the water underneath, the ripples were becoming finer. And then when he got more developed, the water became flat. And the drapes that came off the bridge were no longer symmetrical. The perspective of the bridge changed. And in fact, if you were to have somebody with dementia in your family, and they're artistically inclined, by looking at their pictures that they draw, if they maintain that skill, you will see the dementia advance. And in the extreme end of it, if they still draw, their art will become abstract, which is a scary thought, because if it may mean that abstract artists truly have erased everything from their mind, and what's coming out is the basic core. Interesting, eh? Mm-hmm. So, okay, so that's a little bit of Alzheimer's. If I wax and wane off, forget, these are interesting stories. I thought it might catch your attention, and if it raises some questions, fine. Are people okay so far?